Hello and welcome to CGM webEHR and a rewarding patient engagement approach. In this session, we will explore the essentials of patient engagement. We will also discuss the true definition of patient engagement, as well as how to achieve rewarding patient engagement. We will discuss how to empower patients and their families and some tips on implementing the portal. We will review a patient portal letter, which should be given to the patient at the time of portal registration, and then we will take a look at the entire portal process from the provider as well as the patient perspective. The topic of discussion in healthcare lately has been about how to engage patients in their healthcare. Patient engagement in the past was considered good, but today it is vital to the business of healthcare delivery. Patients' expectations are higher and they demand more control over their care. Thanks to the Affordable Care Act, healthcare organizations and eventually the practitioners will be paid partially based on how they are graded by their patients. Industry standards now focus on outcomes instead of the services delivered. Practices are responsible for improving clinical outcomes and being able to provide the data to support it. Patient engagement can help to improve efficiency, reduce mitigation, and overall costs of patient care. True patient engagement refers to the willingness, knowledge, skills, and ability of patients to manage their own and family members' health and care. The healthcare organization that supports a culture of patient engagement and collaboration between the patients and providers to design, manage, and achieve improved clinical outcomes. Did you know the Medicare Shared Savings Program includes 33 individual measures to assess the care provided by the Accountable Care Organization, or ACOs? 7 are directly related to the patient or caregiver's experience of care. There are others related to care coordination, patient safety, preventative health, and at-risk populations. Patient experience and patient engagement are not the same thing. Engaged patients maintain a closer attachment to their medical practices, experience greater value, trust, and quality in their care, which leads to greater satisfaction, empowerment, and an improved patient experience. To establish a vision of engagement, a practice must understand where it is and what the goal is in terms of patient engagement. What does your senior leadership, board, staff, and patients view as patient engagement? Develop an end-state vision of what the practice will look like when there is a strong patient engagement strategy in place. Achieving practice-wide support is critical for successful patient engagement. When the leadership team has been involved in creating the patient engagement vision, they are more likely to be enthusiastic in implementing it. Use policies and procedures when transitioning with patient engagement. Be prepared with and communicate the benefits of patient engagement for patients, staff, and providers. Having the right technology and services is critical to rewarding patient engagement. Patient portals enhance patient-provider communication and streamline staff tasks. Promote the portal to the patients. Track and celebrate portal milestones, such as a number of emails collected or time saved on phone calls, looking for paper charts, etc. Develop your own definition of an engaged patient. Characteristics may include seeking health information and knowledge, following treatment plans and medication regimens, participating in decision-making, using online health records, and engaging in wellness activities. Distribute short surveys outlining the values, goals, and needs of patients and families. Give patients opportunities to describe their perspective of the care experience. Involve the patients and families in process improvement, redesign work, and/or committees. Work with patients and families in any difficult situation. If someone calls because they could not perform it on the portal, walk them through the completion and encourage them to do it the next time. Promote the portal to existing patients and new patients as they come into the office. Make the benefits of using the portal clear and provide incentives for patients to use it. Providers should explain to the patients how the portal can enhance their experience. Walk patients through logging onto the portal and demonstrate how to perform tasks they will do regularly. Try to understand and address any hesitancy or concerns the patients may have with using the portal. Rely on the patient portal for as much of your communication to patients as you can. The more you use it, the more they will use it. Advertise the portal by posting signs, using telephone on-hold messages, distributing flyers, and/or the patient portal letter to patients. Make it everyone's job to encourage using the portal, from front desk and telephone staff to physicians. Develop talking points for staff that encourage patients to sign up and to use the portal. Develop policies and procedures for response times for messages and systems for routing and responding to messages. Minimize potential loss of patient interest by simplifying the registration process. Designate staff to assist patients with the registration process and to troubleshoot. Educate patients about what kinds of communications are appropriate via the portal, how and when providers will use messaging, and when to check the portal. Let's take a look at the CGM patient portal letter, which should be given to your patient at the time of registration. The patient portal letter is included in the CGM Patient Portal Learning Guide, which is available on the CGM training website. You'll notice the entire process is outlined as well as pertinent information that the patient should keep. This is a great tool for the patient's future reference. To register the patient for the CGM Patient Portal, find the patient's chart in CGM webEHR. Click on the patient's name in the top left corner of the screen to open the demographics page. Enter the patient's email address, click to check the patient portal checkbox in the bottom right section of the screen, and then click Save. The patient then accesses the CGM Patient Portal by going to the website address shown here. Once there, they click the Create Your Account link to complete the registration. They enter the registration PIN produced from CGM webEHR, the first 3 letters of their first and last names, and their date of birth including the /. Then they click the Next button to create their password. They enter their password in the password field, re-enter the password again in the Confirm Password field to make sure that they've entered it correctly, and then click the Finish button. When their account is created, the patient can now log into the CGM Patient Portal using their email address and the password that they just created. Once the patient is registered for the CGM Patient Portal, the practice can easily send a secure message to the patient through the patient portal. Simply open the patient's chart and click on the Send @Direct Message button at the top left of the screen to open the @Direct Message window. Enter the subject and the body of the message, and then click the Send button. The message is sent as a secure message to the patient portal. To view the message that was sent to the CGM Patient Portal, the patient logs into their patient portal account. They can see any messages on the patient portal in the inbox, which is the first screen to open when they log in. To view the message, the patient simply clicks on the subject link to open the message. Then they can click the Reply button at the top of the message screen to send a message back to the practice. They then select Send to send the message. If you would like additional information regarding CGM webEHR and a rewarding patient engagement approach, we offer a variety of training options such as virtual, at your location, or in one of our CGM classrooms. Call 855-270-6700 and select option 4 or visit training.cgmus.com. Thank you for your time and attention.